New England Journal of Medicine, 2003. The U.S. Life expectancy lags behind that of 22 other countries. And the study really attributes this to doctors not applying what is known in the medical literature. Again, the major medical journal. In the study, they state that there are concerns that the medical research are not being translated in medical practice. There's so many great findings, but it never makes it to the practice. Conventional medicine is failing in the United States, and concerned that the doctors are relying on what they learned 20 years before and uninformed about proven scientific findings. So, New England Journal of Medicine, 2003. Same articles, doctors resist change. They basically, what we've been doing is fine, why should we change? They get very comfortable. And especially when they're seeing more and more patients, they don't want anything different. Critical of the U.S. system, that again, a disincentive for improving treatment, especially preventative medicine. They don't have time to sit down and do all the preventative medicine. Reliance on insurance company and pharmaceutical companies for continuing medical education by doctors. So interesting, the makers of Prempro have a great service that they give residents in medical school. They teach them how to do hormone replacement. What do you think they tell them to do? They're very nice of them, isn't it? So New England Journal of Medicine, quote, 2003, the font. Given the ever-growing sophistication of our scientific knowledge and additional new discoveries that are likely in the future, many of us harbor an uneasy but quite realistic suspicion that this gap between what we know about disease and what we do to prevent and treat them will become even wider. We're learning more but doing less. And it's not just recent research results that are not finding their way into clinical practice. There's plenty of evidence that old research outcomes have been lost in translation as well. And that's very true. You look, there's a lot of studies that are old, and they're like, my gosh, why don't we use these? Enormous amounts of new knowledge are barreling down the information highway, but they are not arriving at the doorsteps of our patients. This issue really benefits from research is especially critical. Wall Street Journal even brought this up. And the article was entitled in 2003 by Henry Smith, former president of the American Heart Association, "Too many patients never reap the benefits of great research." He quotes, "Too many of today's doctors fail to pass on the patients the fruits of any discoveries. Serious deficiency in doctors' knowledge of medical studies, and doctors discount studies because it's not what they were previously taught." And then that's huge. And you'll hear so many doctors, oh, there's no studies on bioidentical hormones. Well, I got 100 of them. I got 1,000 of them. And we'll go through a lot of those. So a large part is the real resistance of physicians. Many of these independent-minded souls, like that, they don't want to be told that science knows best and not them. So again, they refuse to admit that what they've been doing for so many years is not the best medicine. So a professor at the University of North Carolina, and that's it. Hey, I've been doing it, don't tell me I've been doing it wrong. So translational medicine is a new term that's cropping up. It's the ability to translate diverse scientific findings into therapeutic protocols for patients. So again, very few physicians learn about new discoveries at scientific conferences and medical journals and translate this knowledge into enhanced treatments for patients. That's what we try to do, is translate all this information to bring it to the patients. And again, a very conflict of interest has arisen in the context of modern day medicine that prohibits translational medicine. Insurance companies and HMOs make it difficult for doctors to practice better medical care and provide disincentives for preventative medicine and better medicine more than anything the basic minimal care. They say, oh, this is basically what you need, that's all you need. You can't go over and above. So again, director of the National Heart and Lung Association. So it's a doctor also in the study. Review of the past medical discoveries reveals how excruciating slow the medical establishment is to adopt novel concepts. Even simple methods to improve medical quality often meet fierce resistance, and that's very true. And even with the bioidentical hormones, there's so many doctors, oh, this is hogwash. Patients have been forced to discover beneficial treatments, insist on them, and that's really, bioidentical hormones have been really patient-driven. Patients have demanded it from the doctors, and they finally say, hey, maybe I should take a second look at this. And the media often bias misinformation and negative sensationalization in papers. It's that Sunday or Monday health section in LA Times. I just cringe every time I pick that up. And I'll tell you a story about one of the reporters there. But one study found that majority of time spent by doctors reading medical journals is looking at the advertisements. And most of the information was retained in the advertisements. It found that when the doctors were asked about what they read, they quoted the advertisements as if they were studies. So these drug companies really know what they're doing. I mean, they can really push these things. Here's quality care you see in the world. The United States is number 12. And the thing is, we spend the most. What's going on? Life expectancy is 10 years greater in Japan than the United States. Now, it's not a genetic thing, because if the Japanese immigrate here, they die just as soon. So what's going wrong with our system? So balance, what do? We want to do balanced hormone replacement therapy, and again, we'll get into that. All hormones replaced to youthful levels, monitored with serum levels. Natural bioidentical hormones that are identical in molecular structure. So basically, that's the difference between bioidentical and so-called synthetic. Synthetic are altered, so they're not exactly what your body produces. Your body's never seen the synthetic hormones before. Bioidentical hormones, they've been making all your life. Again, some people say, well, Premarin's natural, it's from a horse. Well, I mean, it's okay if you're a horse, but it's mostly from a quinoline, which is great, but it causes cancer in women. So again, we do a lot of thyroid, T4, T3, not just synthroid. Many people come in on synthroid. It just doesn't work very well for the majority of people. Testosterone in men and, yes, women. Testosterone is very good for women. Growth hormone, DHA, pregnenolone, and melatonin, and again, bioidentical estrogen and progesterone. And a big thing that we talk about in visits is normal versus optimal. When we send the blood to the lab sends back, by definition, 95% of the people is normal. So only the highest 2.5% and the lowest 2.5% are considered abnormal. So we say you're fine, all that means you're not the lowest 2.5%. And it's ridiculous. And it used to do that with cholesterol, and cholesterol normal used to be 90 to 350. That's 95% of the people. And what they're doing now, even with insulin levels, is because there's so many people with type 2 diabetes, the normals are going up. So hey, you got diabetes, you're normal. So really you want to be optimal. It's a big difference between optimal and normal, or oh, you're fine. That's not healthy. So again, here's a typical, like a thyroid range here. Normal's here. Doctor says, oh, you're fine. But really where you want to be is right here. And it's suboptimal, so you just bring it up here. Only thing is abnormal, they'll treat. Typically, doctors will treat when you're here. But you really want to get you right in this area here. All the hormones have different optimal ranges. So again, there are physiological consequences if hormone levels are not in optimal range. The Rotterdam study, huge study, over 2,000 patients, showed that low normal thyroid levels, so just basically low but normally say, oh, your thyroid's fine, you have a higher risk for heart disease than if you have high blood pressure, high cholesterol, if you smoke, or even have diabetes. So if doctors call me and they'll go, why'd you treat this patient? There's low normal. Well, do you treat diabetes? Well, yeah, of course. Well, then why don't you treat this? Here's the study. So again, normal levels can result in signs and symptoms of deficiency. Bringing levels to optimal can alleviate symptoms and prevent disease. So what happens with treatment? Feel better, more energetic, increased sense of well-being, improved mood, less depression, weight loss, increased muscle mass, increased libido, less muscle and joint pains, memory's improved, concentration and immunity also improved. You have more endurance, improved sleep, increased quality of life. Comes down to increased quality of life. Also, you prevent heart disease and prevent cancer and other also degenerative diseases. So that's it. These people are 240. Okay. And all right. So we'll get into the majority of the talk where I think the majority of people are waiting to hear. How many people have read Suzanne Summers' book? Okay. Well, not as many as I thought. Yeah, okay. Well, we're going to talk about it. And don't run up and kill me if I say anything bad about it. All right.
I shut it when they said something about gaining weight.